Hello and welcome to the CQL webinar on the CQL POST App. We appreciate you making it and joining us today. Just a few quick announcements before we get started. Just so everyone knows, we will be making the slides and the recording available to all attendees. You'll be receiving a follow-up email early next week with a link to where you can download those slides and access the recording. One other announcement, we have all attendees in listen-only mode. You can submit questions via the question box that's on your GoToWebinar window, and then we will answer those questions at the end, since we might be answering some of those questions, as we conduct the presentation. So once again, we will conduct a question and answer session at the end, but please submit your questions via the question box. So now, as we look to get started, I'm going to introduce the presenters today. We have Kathy Adamick. She is the Director of Training and Certification for CQL, the Council on Quality and Leadership. In this role, Kathy coordinates training, develops new training opportunities, and oversees CQL certification services. Kathy has experience in both private and state agencies as a project manager for numerous initiatives. She's also involved in the CMS Look Behind contract, as well as the manager of quality improvement and quality enhancement for the Developmental Disability Administration in the District of Columbia. And we also have Dan Davies. He is the founder and president of AbleLink Technologies and has been closely associated with issues important to people with disabilities all of his life. He has been actively involved in research and development of assistive technologies for people with cognitive and other disabilities for over 20 years. Dan has served as principal investigator on numerous research projects funded by the U.S. Department of Education, the National Institutes on Health, the Defense Advanced Research Programs Agency, and the Joseph P. Kennedy Junior Foundation. So now we're going to be getting started, and I'm going to toss things over to Kathy. Kathy, why don't you take from here?
All right, thank you very much, Seth. So we're excited to be here to talk to you about the POST app. First, I wanted to talk just a little bit about the relationship that CQL and AbleLink Technology has. And many of you know that CQL has been an expert in leading the field in developing tools to define, measure, and improve quality of life or quality services based on the person's perspective of what's really important to them. And we've developed some of the tools, and the POST is one of them. We've developed the personal outcome measures and basic assurances. So it was great that we were able to partner with AbleLink on this, because they, as Seth pointed out, are experts in developing technology that supports people with disabilities to be successful and more independent. And so together we created this POST, and the POST was designed on CQL's personal outcome measures, and then we partnered with AbleLink, who was able to put it into a platform that people could use more independently, or they could use it with support. So we're excited to share this with you today. Before we start, we're going to try to do a quick poll. And the question is that we wanted to know about something about you. And so what we want to know is whether or not, how important is it to you right now that you see family members? So if you just click on the screen on the button, it should show you. I think we can probably close the voting. We have about 86 people, 86% of the folks have voted. Okay, so you should be able to see the results of the poll. And as we said, we had 87% of the people voted. And of those 87%, now there's, according to my calculations here. There are 119 people participating in the webinar. So 87% of 120 people, it went up one, answered the question. 87% said that that's very important to them, that they see their family members. 11% said it was somewhat important, and 2% said it wasn't important at all. So why did we ask that question? And we asked that question so that we could, it's one of the questions that's asked on the POST app. And we wanted to see how important that was to you. You're obviously able to answer that for yourselves. And we wanted to see and think about how can we get that information from people we support. So we can use the POST to do that. And the POST, P-O-S-T, stands for Personal Outcome Screening Tool. And the POST really aligns very much with a person-centered approach. The surveys can be filled out independently, or some people might want some support or need some support and are able to complete them independently. It provides for us a snapshot view of how things are going in that person's life. It helps to assess whether outcomes are present, if they're happening. Yes?
Sorry if I could jump in. I'm not seeing your PowerPoint. We're seeing the organizer screen.
All right, I'm sorry. So now do you see it? All right,
yep.
Thank you.
Thank you.
I apologize for that. So, it assesses the presence and importance of outcomes. And just like the poll question that you just took about seeing family members, it looks at all of CQL's 21 personal outcome measures. And then we can use this information to help us to think about what's important to people, what are people's priorities as we go through trying to figure out what we need to assess more, what we need to learn about people, what's important to people in terms of their planning, and how we might use that for people. Okay. The CQL POST app is available on iPads at this point. It's only available through the Apple format. There are many features on it that make it very user-friendly, and Dan's going to actually demonstrate that to you in a little while, so I'm just going to talk about that briefly. But there are features in it that allow you to hear or read and hear what's being said. It takes usually about 20 minutes or so to complete, and there's audio playback, so you can get things repeated if you want to get things repeated. You could have things said in English, or you could have things said in Spanish. There's, a button that tells you some more information, so if you want to hear about it a little differently. And then there's some reports that come out of the survey, out of the app. And we'll talk about those in more detail later. We'll also talk about, oops. I'm sorry. We'll also talk about how you can use those results. So first I want to do another quick poll. So because it's only available on an iPad, we're asking whether or not people that you support through your agency have access to an iPad. We're not asking whether they've used it or not, just whether or not there are perhaps some iPads that people have available to them. Okay, I'm going to close that and share those results with you now. And you'll see that for many of you, people do have iPads. Almost 75% of the people that are participating in this call say that people that they support have access to iPads, and only about 25% don't. Now, hopefully you can see my screen again now.
We're seeing the welcome screen, Kathy. If you could switch back to your PowerPoint.
All right, I did. Okay, so thanks for checking that for me. So the CQL POST app is, we've found it particularly helpful when people are new, when you don't know them well, to use as a screening tool. We found it works well with people who are perhaps receiving intermittent supports, maybe not so much that you're not as involved in their life 24 hours a day, but maybe you provide supports on a more infrequent basis. It's kind of almost more as needed. And then we've also found it very helpful to help guide where we need to go next. What are the next steps for that person? So we've really found it useful in that way. The POST app, as we said, is available in the iTunes stores for about $75, and you get 15 free surveys when you do that, and that gives you access to online data reporting and reporting. We'll talk about that some more as we go through. So you get login access, and then you have the option to purchase more surveys. So in looking at that, I just want to real quickly understand a little bit about what you're thinking at this point. Are you thinking that, what do you like most about the post at this point? You like it because it's short, it's available in Spanish and English. It costs less than $75. You like it because it's versatile, or you really don't know and you want us to keep talking? Okay, so I'm going to close the poll now. About a little over 80% of the folks have voted. And you should now be able to see the results, and you'll see that many people are still looking for more information. But so far what's appealing to people seems to be about how short it is and that it has many uses, or it's versatile. So we talked about those results. Now, so let me tell you some more about the post, since that seems to be what's important to many of you at this point. And as I mentioned before, the post is based on CQL's 21 personal outcomes. And those outcomes cover a range of things, from people being safe and healthy to people having relationships that are important to them, people exercising their rights, people being respected, people having social roles. So it's around those things that we have over the course of time, and in learning about people, have determined these 21 areas seem to be typically important to everybody. And so this looks at what about those outcomes are important. So we really ask two different questions about each of the areas. Now, I keep saying there are 21 personal outcomes. For some of the questions, some of the outcomes, there's only one question. For others, there's multiple questions to get at whether or not the outcome is present for people and how important it is. So we asked two specific questions. One is, how's it going for you right now? And then, how important is that to you? And you can give us some information about whether or not that's going really well, it's going somewhat well, it's not happening at all. How important is it? It's really important, it's somewhat important, it's not important at all. And again, we're going to do the live demo later, and you'll be able to see that for yourselves. So one of the questions, just like I told you that at the beginning when we did that poll, that it talks about family members, there's another one about how's it going for you right now when it comes to seeing doctors and dentists and other medical people. Is that going really well? So for this person, they said it's not happening at all for them. So they're not satisfied. There's some things missing in this for them. And then we went on to ask them, how important is it to you right now that you see doctors, dentists, and other medical people? And we discover that it's very important to the person. So first, we know that it's not happening and it's very important. So what does that tell us? That tells us this is very important to the person. So it's a high priority, not happening at all. And so we need to get in there and discover what's not working and what is working to see if we can figure out what's going to make it better for that person. So that's the kind of information it gives us. Based on the answers to the questions, you get, and I mentioned before, there are simple one-page report. It's front and back. You're only seeing the front of it on your screen now, but it talks about the different, the 21 different personal outcome measures, how it's going, and whether and how important it is to you, and whether it's a priority or not. So clearly, and this particular person, abuse and neglect is going very well. It's very important, but it's not a priority because it is going well. So we have a formula that we use to figure that out, and Dan's going to get into more detail about how you get into these reports. But this report is one that you're able to have emailed to you, printed out. The person can actually bring this to their meeting and help write to you what's going really well, what's important, and what the priorities are for them. The other thing that happens is that in the reporting section, you can actually an aggregate report about how things are going. So in this particular, on the other side of your screen, you'll see a bar graph. And in that bar graph, there are 17 people who survey. And for some people, it wasn't happening, but for most people, it was going really well. And you get that for each one of the different questions. And so that helps you specifically at how things are going within your program or in your organization. So we know that some of you are on this call because you want to know more about, but we're wondering if some of you have perhaps purchased the post or thought about it or are interested in the post, or if you're just for maybe the first time. So we'd like to see kind of where you are in that process. So we have another poll we'd like to ask you about. Okay, it looks like a little over 85% of the people have voted. So we're going to go ahead and close this, and I'll share with you the results of the post. And so clearly some of you, 11%, have already purchased the post and are on this call to learn more about it. 11% of you have thought about buying the post and again are on this call to learn more about it. 19% are interested, and 59% are just now learning about the post. So that helps us to kind of have an idea about where you are and what's going on. So we appreciate that information. So I'm going to hide those results now, and then hopefully you'll see my screen.
We see the welcome screen now, Kathy.
You're on the welcome screen?
Yes.
Sorry. Okay, thank you. So now it should be up.
Yep.
So as we talked about it, the POST app is based on the personal outcome measures. And what we learned from our customers and from people is that the personal outcome measure conversation or interview typically takes between an hour and a half and 2 hours. And that's a really long time, really, for different groups of people. So they asked us if we could think about how we could make it. Came up with this screening tool that helps us. It doesn't give us the depth of information the personal outcome measures gives us, but it helps to give us some information about what really matters around those same things, around the 3 different factors: myself, my world, and my dreams, and around those 21 outcomes that I talked about earlier, including things like people are free from abuse and neglect, people choose where and with whom they live, people choose where they work. And it also tells us about how we can assess the supports that people are getting, and evaluates many different variables, including whether or not guardian, whether or not somebody lives in a 24-hour, receives 24-hour supports, or whether or not they're living in their own home with their family or in an agency-owned home. So we set out to develop the post based on what we were hearing from our customers about wanting a shorter screening tool that would help to give some level of information for people who received less than 24-hour supports, and for people who were perhaps more dependent, older, and entering service supports, or people who were perhaps had lived experience in the mental health. Okay. So the post works with the personal outcome measure. It doesn't replace it. It's in the post, if I discover, if we go back to the example we showed earlier with the person who said that he wasn't going to the doctors as often as he felt like he needed to, we might use some of the questions from the personal outcome measures to help explore that, or you might do some other ways of exploring what's important to them, to that person, to help plan. And the post is for, kind of a screening. The personal outcome measures gives us a more in-depth look, but they both inform the person-centered plan and help us to look at how our things are going, what's important, and what do we need to do to help this person have the quality of life that they want. So we know that many organizations are really finding the value of using the personal outcome, the POST screening tool, because many organizations have downloaded it and hundreds of surveys have been taken. We've found many uses for it as well, and I'll talk about some of those in a little bit. One of our partners from Melbourne, Australia, has said this has really supported people to focus on their priorities within their planning meeting. It helps them to come in with some information that helps them. And then another partner has said it's really helped the team to look at what's important to the person and where do we need to go next in helping to develop an individual service plan or support plan. Dan now to kind of me and for us and to do his live demonstration and talk a little bit more about AbleLink's contributions into the process.
Okay, great. Thanks, Kathy. I'll pick it up, and then we'll be going back, and Kathy will be finishing up in just a bit. So, just to give you a little background, the POST app itself was developed using our Atlas, evidence-based tool for developing cognitively accessible tests and surveys. Basically, our focus has been developing technologies for folks that can't use a lot of mainstream or approaches to gathering information, such as a written survey or even something like SurveyMonkey. You know, individuals with cognitive disabilities or those with low literacy typically may have difficulty using those traditional methods for gathering information, and so that's why we got together with CQL to build the POST tool using this research-based approach.
Hey, Dan?
Yes.
Sorry to jump in. Would you be able to minimize your GoToWebinar window?
I certainly can. Thank you.
Thank you.
There we go. Thank you. So when you go to the App Store to download the app, and we'll give you some more specifics as to how to find it and such later. But you'll notice up on the screen here on the top right, I just typed in CQL Post and did a search in the App Store, and that's how you can find it. You can also find it from the CQL website, and they'll give you specifics on that in just a bit. So once it's downloaded, you have the app on your iPad, and when you launch the app, this is what you'll see on the screen. Before I actually launch the app, I'm going to show you how you would set up your agency's usage of the app. So let me show you those screenshots that you'll see. So the first time that you launch the POST app, you will see this login page, and you're only going to see it the first time that you launch the app. After you've set up your agency and you have an agency ID, you won't need that any longer. It'll just bypass these screens and go directly to the beginning of the survey. But let me explain how this works for those of you who are considering using this app. So initially, when you see the screen, you'll use the blue Create Account button. And once you hit that button, it gives you the opportunity to enter your agency's name, and you select a password. You enter a password of your own choosing, and then just keep track of that password because you will need it later to access the reports online. That's all it takes to set up after the information is entered into those two fields. You click the Finish Setup button. Then you'll see a screen that looks like this that shows that your setup is complete and gives the agency ID to you there, presented on the screen. So you want to write down that agency ID as well. So the kind of the three key bits of information to keep track of is the password that you entered, your agency ID, and then here is the website that you will use to get to the reports, the postscale.ablelinktech.com website. After you've done that, you're ready to go, and it'll launch you directly right into the app. Now I'm showing this screen once again because if you have a second iPad that you download the app for, and now you want to have both of your iPads collecting data and contributing it to your one agency database, when that second iPad when you launch the app on that second iPad the first time, you'll see the same login. You want to make sure you don't create another account. You just simply enter the agency ID in that field up in the top center there. That was created the first time, the app was run on the other iPad. That way you have one agency organization, and you will use that same process for any iPads that you might want running the app. So that's how you set up an account. And now I'll show you how the app works itself and kind of describe some of the user interface features of it. So I'm going to
press the start button when you are ready to begin.
This is the start page you'll see when you launch the post. A couple of things I'll mention. Your agency ID is actually listed up here in the top left of the iPad screen. Forget it. You can always view it by just launching the app and keep track of it that way. As Kathy mentioned earlier, you have the opportunity to have presented in English or in Spanish. So this is the point where you would select that. If I select Spanish as we move forward here, we hear both the audio and see the text on the screen. All in. For purposes of today, I'll go ahead with English, and I'm going to hit the start button now.
For the next few minutes, we are going to ask you some questions about your life. Each question will have two parts. We want to learn about you, going for you. We also want to learn what's important to you when you think about your life right now.
Okay, the first few pages in the app are explanatory, to give them information. You'll notice that the audio that you hear through here is not computer generated. These are recorded voices, which are much more understandable for individuals. And of course, if we had selected Spanish, you'd hear that in Spanish and see the Spanish text. The button on the bottom center allows you to replay whatever message has been played at, when you came to this screen. I'll go to the next one.
First, we want are going in each area of your life right now. When I ask you how things are going, you can tell me, this is going really well in my life right now. This is going somewhat well, or so-so in my life right now. Or, right now, this is not happening for me at all.
I'll click next.
Second, we want to learn about you and the things that are important to you right now. When I ask about what is important to you, you can tell me, very important to me in my life right now. This is somewhat important to me in my life right now. Or, right now, this is not important to me at all.
Next, once again.
Myself. These first few questions ask about you, your experiences, your friendships, and the decisions you make.
There are the content and the questions are presented in several kind of categories, and myself is the first category. So after I click next here, we'll see the first question itself.
How is it going when it comes to seeing or talking to family members as often as you want?
Okay, so this is the interface that's used in a consistent way for each of the questions that are presented at a time. You'll see the text on the left-hand side. Sometimes there'll be a picture associated with that, if that's useful. And then on the right-hand side, you see the response options. Now, you'll also next button to advance to the next item in the survey at this point, because no response has been provided. As soon as I select one of the responses, then the next button will appear. You'll also hear the audio of the respective choice that was made. And note that even though you see just a couple of words on screen, the response option is actually more explanatory than that. So I'll select the middle one here.
This is going somewhat well, or so-so in my life right now.
Now, the individual can listen to each one of these responses and see what they say.
Right now, this is not happening for me at all. This is going really well in my life right now.
So after they've listened to them all, or if they're happy with their choice they make after their first selection, they can now move on to the next item. And before I do that, I'll also point out the replay buttons on the bottom. The blue one to the left will replay the question just as you heard it when we entered this page. The pink one actually uses a different voice and asks the question in a slightly different way.
I see or visit with my family as often as I would like. I decide when and how often I can see my family.
So that's what we hear when I press the pink replay button. I'll go ahead and select next.
How important is this to you right now?
So after we've asked about the topic, this second page kind of follows up with how important is that topic to you. So if the individual wants to hear the entire question again, the blue replay button will actually play that question back, as well as the full text on the screen.
How important is it to you right now that you see or talk to family members as often as you want to?
All right, so I can make my selection here of how important this is.
This is very important to me.
And then press the next button to continue on. So as you can see, the interface is designed to be very accessible to individuals that would have difficulty using a written form or an electronic form like SurveyMonkey, where they still have to be able to read, that type of thing. Many individuals can navigate through this type of interface completely independently. Other individuals might need some assistance, but they have, they're participating to their full extent as they go through it, which is very beneficial. Now, there's quite a number of different categories where information is asked about. So I'm going to go ahead and close the survey down right now, and we'll look at the reporting real quickly. So let me do that and close this out. Now, one thing too is, as you're using the iPad and you're collecting the survey information and the individuals going through it, if for some reason you have to kind of take a break or stop, the app, or the individual's the home button and the app closes, you can just simply relaunch the post, and it gives you the opportunity to continue the survey right where you left off, or restart the survey and start all over. So if I hit continue survey here, you'll see it will pick up with right where we left off.
How is it going for you right now when it comes to having someone in your life with whom you share special information and experience?
If you do choose to say restart survey when you launch the post the second time, any data that had been collected up to that point will be discarded, and you have the opportunity to just simply restart the survey. That's how the post works. If you are online when the post survey is being taken and completed, at the end of the survey, the data is immediately transferred to the cloud for you to be able to review the reports and access any aggregate results. You also have the opportunity at the end of the survey to enter in an email address. And when you enter in that email address and complete the survey, you will get an email sent to whatever email address you entered, similar to what you see on the screen here on the top left. So this is it says Atlas Reports Post-Scale Survey Completed, and there are two links in that survey. The first link allows you to have access to the individual specific summary responses for every item that they selected, and we'll take a look at that. One provides you a link to view the post outcome screening tool results special report. I'll click on that one so you get an idea what it looks like. On that, it actually opened up my browser and took me to the results of that specific survey. So here is the survey results. that categorize for each of these primary categories, like myself is the first one here. And as you saw in Kathy's PowerPoint just a bit ago, the results are presented here for how well each area is being attained and the importance of that area. And together that information is used to identify priorities for the individual. So I scroll down the page here. My world is the next category. My dreams is the third category here. So this report can be simply printed from your browser, and you'll have it if you need. All right, so let me close that out, and we'll take a look at the second reports. I want to make a point. Entering the email address is optional at the end, so you don't have to enter that, but that is a way to get immediate access to that report when you do go ahead and enter an email address. Please note that if you are not online when you are having the survey completed, that email won't go out until that iPad is back online, whether through 3G, 4G, or Wi-Fi somewhere. So any surveys that are taken when the app is offline will be stored locally on the app until you get into connectivity again for that device. So you may take it to sea, and when you're back in Wi-Fi connectivity, just simply launch the POST app, and it will, at that time, once you've launched it, it will send any stored surveys up to the cloud. At that time, any emails will also go out that correspond with those surveys, so you can access those reports. To the reports is simply going directly to the website itself. So I'm going to click on this lower image here, and you'll see my login. This is where you use that agency login information. So I'm going to enter mine, and then the password. And again, this is the password that you yourself, whoever created the account for your agency, entered at the beginning. And that's why it's important to save your agency ID and the password. So you utilize that information to log in, and now you see a page that will show you all the surveys that have been taken. You'll see here that the last survey was taken on 3/31/16 at 9:37 a.m. The total surveys that have been taken for all of the iPads that are using the POST scale within your agency. And then you have the opportunity to view the aggregate results with this Show Results button. So when I click on that, you'll see bar charts that address each question in the survey. The other button, Download Raw Data, allows you to actually download a raw data file that you can use to pull into Excel or SPSS or something like that. So that's something important to know. I'm going to click the Show List button. This allows me to see all the surveys that have been taken. I can view an individual survey and the specific choices each individual made, or the individual made, for every item in the survey, and print this one out. That's kind of a summary report. And then the second type of survey that I can do here, click my back button, will be the personal outcomes survey, and this is the one we looked at just a bit ago from the email link. So same report, it's just a different way to get to it. And incidentally, the second one here was done in Spanish, so when I look at the results here, you'll see the whole report is presented in Spanish. So that is useful as well. All right, so let me click back here. I'm going to close out the survey there and move on to the final page here. These are some of the most common questions we have. How do we connect all of our iPads that have the POST app to our agency's database? I kind of went through that. That's where the first iPad that you use the app on, you'll create an account, and then after that you won't create any more accounts. You'll simply use the agency ID that was created from that first time you used the app, and that way you connect all of your iPads to the same database. What happens when surveys were taken, they're taken when my iPad is not online. I talked about that just a bit too. You never lose a survey if you're offline. It's all stored locally on the device until you have connectivity, and then any number of surveys that are taken while you're offline are sent to the cloud. How can I keep using the app after the 15 initial surveys are completed? Basically, the app is set up that you have 15 surveys that you're purchasing at $75 when you buy the app, which is $5 a survey. If you want to continue to use it after that initial set, then you just send an email to AbleInc and we can give you the options for purchasing either bulk, a set of surveys in advance, or just getting set up for kind of quarterly billing of those surveys. And we'll talk just a bit more about that in a bit. Another common question is, what's the web address for viewing the survey results? And this is it on the screen here, postscale.ableinktech.com. And that is presented when you create your account. It's right up on the screen, the same screen that you're copying down your agency ID from. All right, that's the run through of the app. I'm gonna send it back now to Kathy.
Hi, I'll get my screen up in just a minute. Sorry, the transition kind of. Thanks, Dan, for that. That helped us to see how the Post app works and a live demonstration of it. I just wanted to share with you quickly so we can get to all of your questions. My most recent experiences with using the Post app have been on a project that I was working on where I was talking to potential class members in a class action lawsuit about what they wanted out of their lives. And we used the Post app to help people think about what was important to them and how things were going and whether or not they wanted to make any changes. So in doing this, I talked to a lot of different people, and sometimes people were able to completely and independently, once I gave them the iPad, they took off and did it completely independently. To other people who I demonstrated it for a minute or two, and then they were able to go with it on their own. To other people who maybe I sat and we went through each question independently, and because of their mobility issues, maybe a stylist or moving it forward and backwards when they needed to answer a question was helpful to them. So after listening to all these things, I hope that you're still interested in more about the posts. I just wanted to tell you that there's a lot of information on CQL's website about it. So what's next is you could go and read about it on there and see some of the things and check or call us and talk to us about it. You could, if you're ready to make your purchase, get your iPad out and get it all powered up and go to the CQL website, find the post, and then click on the App Store button. Click on the amount, the purchase price, and then click on Buy, and then follow those instructions that Dan said to set it up. We have some questions, and I think some of your questions will be answered here. So remember that you get, for that initial purchase for one iPad, you get 15 surveys, free surveys for that account. And so some people are now at the point where they're looking to get more surveys. And so we've come up with this tiered system, and you can purchase them ahead of time. What I want you to think about is what you're purchasing here. What I want to make sure you understand is what does your amount per survey get you? It gets you that individual report. It gets your Post app your results stored in the cloud forever, or as long as, you know, forever. And then you get the results of those multiple questions, because remember, although there are only 21 outcomes, some of them have more than others. I believe there are actually 68 total questions. And what you get is the answer by question for each person that then can be aggregated, and without you having to go in and enter the data, it minimizes the possibility for errors and those kinds of things. You can export all that data and do all kinds of work around with the data to look at programs and such. So the cost per survey is, as it's explained on the screen, you can do these, and you can purchase up to 500 of them for this price, and you have until you use them up to purchase them. So if you purchase them now and you did 10 surveys a month for the next 12 months, you'd still have additional surveys left that you can use. I'm going to ask Dan just to talk about if you wanted to do that on a more of a quarterly billing plan. Dan, would you talk about that?
Yeah, sure. Quarterly billing just provides you the opportunity, when you're not really sure how many surveys you might be using over a period of time, to simply be billed quarterly for the ones that you do use. So we set up an account and just at the end of a quarter check to see how many surveys have been completed, and then you just get an invoice for that. So it's a simple way to do that. And the alternative that Kathy was talking about is kind of a bulk purchase, where you can purchase them in advance, because you may have an idea, well, this is about how many we might be using. And as Kathy said, there's no time limit on when you can use them. You have them to use, whenever you choose. So essentially the $5 per survey is the same as what you're paid for when you bought the app, because 15 surveys times 5 is $75. That's where that number come from. So we're just providing you the opportunity to continue to use the app in the same way as when you initially purchased it. And as Kathy said as well, if you compare historically written surveys, require data entry after the fact. One of the things that's really beneficial of this is that there is no data entry. You eliminate that cost completely. So it might take, 15 to 30 minutes for someone to do the data entry for the 68 questions in here. And then there's the opportunity for, human error in that. That's, that's part of the benefit of an automated tool like this. Over to you, Kathy.
Okay, thanks, Dan. We wanted to give you an opportunity. We're skipping the polls, and we wanted to give you an opportunity to ask any questions. Many people have already submitted those, and so we'll take a few minutes to answer those questions. And I just had thunder in my background, sorry.
So Kathy, I can kind of direct questions towards both you and Dan. I'll try to get through as many as we can, but we do only have a few minutes left here. One question we just received, and I can actually answer this, was what other platforms the CQL POST app is available on. Currently, it's only available on iPads, but know that we are in talks to possibly expand that to Android and other devices and platforms in the future. Kathy, I'll direct this question towards you. Someone asked, does someone have to take the 4-day PALM workshop to use the POST, the Personal Outcome Measures workshop?
And that's an excellent question. That is one of the differences. No, it is all self-contained, and so you do not, that's the other benefit of using the POST as a survey tool. So you do not have to take any training. You purchase the app and you're ready to go.
Great. And I did get a couple questions about slides and the recording being made available again, you'll be receiving an email early next week that'll contain a link to access the slides where you can download them, and also a recording of this webinar where you can watch it again or share it with others. Kathy, I'll direct this question towards you. Someone asked, where do you enter the person's name that is using the app?
Okay, that's a good question, because certainly when Dan was demoing it, we just started with the app. There's a demographics section at the end where you enter the person and a few pieces of information about them, including the email address and such where you want it sent. So there's a demographic piece at the end of the survey.
Great. Next question, Dan, I'll direct it towards you. Someone asked, is there a way within the app to mute the sound? Otherwise, they did say that they could just turn down the iPad volume, but is there a way to mute the sound?
Let's see, within the app, there is not a way to turn the sound off. You simply would just turn the volume down.
Excellent. And then, Dan, I'll also direct this question towards you. Would quarterly billing follow the same price as listed? If you do 550, would they all be $4 each for the quarter? But if you complete 45, they would be $5?
That's correct.
Excellent. So I'm just scrolling through the questions in order. They're asking, can you check this would be towards Dan. Dan, can you check the data in the cloud without using the iPad app? Can you log into the website to check it?
Yes, absolutely. The web address that is provided to you when you set up an account, you can access from any desktop computer, Windows computer, or a device. You don't need to access the data from an iPad. You can do that from another computer.
Great. And Dan, another question for you. How many people can have their surveys stored on the account? I think they're asking kind of about a capacity limit.
There really isn't a capacity limit. The data, data doesn't take a lot of space to be stored, so there's really no practical limit in terms of storing the data, as well as no limit to the number of iPad apps that you want to connect into your same agency.
Great. And another question was, how long does the app save each survey result? And essentially, that I can answer that. Essentially, forever, for as long as you need to access them. Kathy, I'll direct this question towards you. Will the information be linked to the results in the online data tool, like the Personnel Measures database?
Now, those are two different database systems, and so they will not be linked.
Great. And what I would also add to that, though, as Dan had mentioned earlier, is that these results can be exported into CSV or for SPSS. So, I mean, on an organization side of things, they could, I'm sure, come up with a way to kind of integrate the data, but no, like Kathy said, they don't directly connect between databases. I'll ask this question towards Dan. Can the data report be grouped for time frames, such as surveys completed in January, or a date range, such as January through March?
At this time, that's not a capability to have a date range. It's something we've looked at exploring, so it's good to hear the question that people are thinking of that. But at this time, that's not a capability.
Great. And I'd also add that, similar to the last question, though, that if you're exporting to a CSV or SPSS, you could possibly come up with your own customized reporting capabilities. We're pretty much hitting, if there are more questions, we've pretty much hit the end of our webinar time, so we're going to close things out, but do know that if you submitted a question, we did receive those, and we will try to follow up with you either individually or maybe put together a question and answer page where we can answer these and share these with attendees. So I'd really like to thank our presenters today for the webinar. I feel like a lot of really good information was shared, and hopefully our attendees believe that as well. And I'd like to thank everyone for coming today and attending this webinar. We appreciate you taking the time out of your day to learn more about the CQL POST app. So we will be sending an email next week with a recording and the webinar slides. Thank you so much for attending.